Cold, flu, and COVID, it can sometimes be hard to tell the difference. WDRB's Valerie Chin explains what you should look out for and what hospitals are seeing.
It was a light flu season last year, but 2022 could be different.
When people use the term twindemic, what does that mean?
Some had predicted a twindemic where we would have a pandemic in regard to flu, influenza, and the continuance of the COVID-19 pandemic. So double trouble, really.
With COVID cases on the rise, Baptist Health says it currently has 61 COVID patients hospitalized in Louisville, 52 at its Floyd location, and 15 at its La Grange location.
A hallmark of the COVID-19 infection is that loss of taste and smell. So that's a big differentiator, if you will. And then some of the symptoms are the same, but in general, colds, more limiting, not usually a fever.
Angela Sandlin, the director of pharmacy for Baptist Health La Grange, says the only sure way of knowing what you have is to get a flu or COVID test.
What's your best advice for people who are having a hard time finding a COVID test in the stores for the at-home test? They also are having a hard time because it's a holiday weekend.
That is especially challenging. And I would say that calling around, seeing if some are available, because we found the availability of those tests to be sporadic.
And doctors continue to urge people to get vaccinated for COVID, get a booster shot and flu shot.
We're also starting to see flu, and it is possible for people to be infected with both of them at the same time, and that is likely to be miserable.
If you find yourself sick this weekend, many urgent care locations are open and ERs too.
Our emergency rooms have been quite busy with various people in various forms of COVID-19 illness.
What trends are you seeing for people who are now contracting COVID?
The trend we have definitely seen in our hospitals are patients that are vaccinated have less severe illness.
Valerie Chin, WDRB News.